My reasons are more personal. I decided to become a nurse because I enjoy helping people and I wanted to give back to my community. And I feel like becoming a nurse is a great way to do that. I feel like helping people is my purpose. I love helping out my family, and I've been a CNA for going on 6 months now, I believe. And I've enjoyed my time being a CNA because I was able to help people who didn't have anybody to help them.
Tell me about yourself.
I'm a very hard worker, and I always try to put 100% in everything. I really don't give up very easily. It takes a lot. And I pretty much just feel like I'm very motivated to do the best that I can in everything that I do.
Are you comfortable working with other doctors and nurses?
Yes. As I said, I've been a CNA for going on what I believe is 6 months. So I have to work very closely with nurses. I've not really had any interaction with the doctors as I work night shift, but I interact with our nurse practitioner. She's a very good woman, very sweet, and she helps me out a lot. She teaches me new things, and she's trying to help me become a better nurse, as well as the nurses that I work with.
What do you find is the hardest part about being a nurse?
I find the hardest part about being a nurse is that you can't help everyone. There's some stuff that's out of my scope of practice. There's genuinely things in this world that are incurable. And the hardest part would probably be my patients dying. I have a horrible problem with getting very attached to all of my residents or patients. And I always want the best for them, and I try to give them the best and make sure that they're very well taken care of. And if that can't happen, I get a little upset.
How do you deal with someone who isn't satisfied with your patient care?
The first step is that I usually do, I go to my supervisor. I talk to her about the situation. I tell her what happened. I do my best to try to solve the situation with the resident. If I can't, I'll have my supervisor or my RN above me come in and talk to the patient with me. And if that doesn't work, I would have my supervisor call the physician who created the order or is giving me, the stuff that I'm supposed to do. And I would have them see if they can try to help me find a way, like give them a different medication, see if that helps them better and takes off the pain or helps them breathe any better, or see if there's anything else I can do personally to try to make them more comfortable or try to solve whatever's going on that's making them upset.
Work as a team. How do you handle the stress of a job?
It's hard. I kind of have a horrible problem with stress, but being in nursing school, I've learned to kind of tone my stress down. I don't let it affect me at work, and how I ease the stress once I get home is I usually just take some time to myself. I'll sit in a dark room. I might watch a movie. I've started reading again, so I will read a book or a couple chapters out of a book, or I'll just spend some time with my daughter. I find that very stress relieving.
Why are you the best nursing candidate for this position?
I feel like I'm the best candidate for this position because I'm an extremely hard worker and I'm very diligent. I always try to do my best, and I feel like at everything that I do, I've done my best. Sometimes it's not easy, and I've learned to accept that. And I feel like I'm your best choice for this position because of my intelligence, and I love working on a team. I find it's much easier to work on a team than work alone. I'm a big team player. I will step in and help whenever I can, especially the CNAs, the doctors needing help doing something or a procedure to our patient or resident. And I've learned that since I've been a CNA that some nurses don't like helping my CNAs, but I know that when I have time, I will help. You always should be a team player.
Would you say you're a team player?
Yes, I always do my best to work as a team. I work nights at the facility that I'm at now. We usually only have 2 caregivers and 1 nurse. I try to help my nurse when they're doing bandage changes, and we have some residents that are 2-man teams, or me and my other partner on the floor with me. We will do people together just to